So the first thing we're going to do is compare our physician's orders to our mark. And they're all correct. So then I'm going to put my physician's orders away. I'm going to grab my patient's drawer out of the cart, make sure I lock it back, and bring the keys.
Thank you.
So then we are going to check that our medications are correct.
Situation in my hands. I have gloves on.
And they are. So then we're going to start pulling our medications out, making sure they're correct again. This is our second check.
Is heparin the one we have to switch needle tops? Is that the one that's irritating?
We are going to start getting our injections and our medications ready. So the first one I'm going to do is my oral, but before I do that, I wanted to make sure that there is no contraindications or indications I need to be aware of. It's the right dose and the right route. So we're going to go ahead and start getting them ready. So the first one we'll do is our oral. And this one did need some math, and I went ahead and did that, so we're okay.
I never pull these out, so.
We'll set this to the side. And then we are going to make sure this is the correct appointment. And it is. Set that to the side. And now we are ready to start doing our injections. So we'll make sure this is the correct one. And now we are going to clean the side.
It doesn't leave the side.
Well, it doesn't really.
And then you don't rub.
No, you don't have to.
Let that dry.
I've read conflicting things.
Make sure we have the correct needle for this. And we will want to draw back the dosage of 1 ml of air. Remove our needle. And then we will insert it into the vial, making sure that the hub does not touch the vial. Insert the air. Invert it. And then we will have our medication ready. We will recap it. And then we'll make sure this is the correct dose, 1 ml. And I'll just set this to the side and label it.
What did we tell y'all about yesterday?
So that one is correct. And now we are going to do our heparin. So we are going to make sure again we have the correct medication, correct vial. And then we will draw back our dose of 2.5 ml of air. And we will make sure that we clean the top of this vial. Let it dry. Remove our cap. And then we are going to insert, make sure the hub doesn't touch. Insert our air, invert it, and then we are ready to start getting our dose of 2 ml.
And it says what?
That is a 25 gauge.
Okay, 3 mil,
Yes.
5/8 of an inch.
Yes.
Okay. What does this say?
That is
So then we'll just pull
1
that out.
milliliter. That's
Cap it.
27 gauge and a half inch.
We
Okay.
have rollers all the time.
This.
Push it up against a hard surface.
Yeah.
And then again, make sure we have the
This
correct
is
dose.
your Sub-Q.
And then we will label it. And this one is a high alert medication, so we'll need a nurse to come in
Oh,
and
that's
verify
right.
this is the correct dose against the
I don't know
mark.
what I'm thinking. My brain fog.
And then we are ready to do our intramuscular.
Well, it's better to come now than when I'm.
So then we will again cleanse our site of our vial. Let that dry. And then we are going to make sure that we get the correct dose of air in our syringe. Remove our cap. Insert it.
It's very easy to get that on.
Hub doesn't touch. Invert our air.
1 milliliter.
And then pull back our 2 mLs. And then again, we will put our cap on. And then with this one, we want to make sure that we would change out the needle top because when you insert it, it does get dull, and we want to make sure this reaches all the way down into the muscle. So then we are going to label this one as well. And this one is our Murpidine, so it does also have to be verified by another nurse. So there's our dose. Want to make sure we have that right. Make sure you can see it. Okay. I'm just going to set all this to the side now. And now we are ready to enter our patient's room. So we'll go in, knock on our door, introduce ourselves. Hi, my name is Ashley. I'm going to be your student nurse today. Can you tell me your name and date of birth? She says her name is Valerie Jones and her birthday is 11/9/81. So that is correct. So then we're going to provide for privacy, wash our hands, and we are going to raise the bed. And we'll raise the head of the bed because they do have an oral medication today as well. So the first thing we're going to do is we're going to ask the patient if they've ever had any of these before, and they said they have had injections, so they're not worried about anything, and then we'll go ahead and put on our gloves. And this is when we would do blood pressure or pulse if we needed those with any of these medications. So then we ask our patient if they will need help taking their medications. They say they don't. So we just hand them their meds. They take them, ask them if they need any water. They say they don't. So we're good to go on that one. And then we are going to do our topical. And so this one does go on his left arm, or her left arm, so we're going to make sure that we clean that site where that wound is. And then we're going to let that dry. And then we are ready to put on our ointment with clean gloves. Put that on, just a thin layer on that wound. So we're done with that one. And now we are ready for our injections. And we're going to go ahead and start with her intramuscular. We make sure that she knows that she is getting it in her vastus lateralis today. So we're going to explain to her where that is. So then we're going to have her just turn to her side so we can get to this easily. It's going to be a hand below the groin, hand above the knee, and then our thumbs together. So this site right here is where I'm going to cleanse. Make sure we get our alcohol swab. So then we want to make sure we have our appropriate dose to administer. And then we will go in at a 90-degree angle and inject. Let it sit for a second so that way that we know we get the medication and our sharps. And then we will just apply some gauze, ask if they need a band-aid, and they don't. So then we're going to move to our next injection, which is going to be their intradermal. So this is her TB test. We ask if she's ever had one before, if she's ever had any complications, and she says no. So then we're going to go in and cleanse that site on the forearm. Let it dry. And then we are going to go in at a 15-degree angle. And just insert that medication, pull it out, watch for our bleb. Make sure that the patient knows that she has to come back within 48 hours to get that read. And then just gently pat with gauze, and it doesn't need a band-aid because that could hinder the test. So then we are ready to give our last injection. So this one she knows is going to be in her anterior thigh. So we're going to go and we're going to do a hand below the groin, a hand above the knee, and then right here is just going to be our site. So then we will take an alcohol swab. We'll cleanse that area. And we will take our needle. And this one we want to make sure we have 2.5. And then we are going to go in at a 45-degree angle and insert our medication. Pull that out, throw it in our sharps, and apply gauze. So then we ask our patient if they need anything. They say they don't, so then we'll cover them back up. We'll lower the bed. Ask them if they want to stay sitting up, and she does. Let her know that I'll be back in 30 minutes to come check on her. I'm going to clean up, so I'll get rid of all of this. And then I will go wash my hands, pull her curtain back, and then I will go document. And that is all.